Millions of people have now seen this photo capturing a doctor comforting an elderly patient on Thanksgiving Day. Joining us now is that doctor, Dr. Joseph Faraone. He's the chief of staff at the United Memorial Medical Center in Houston. Dr. Faraone, as always, thank you so much for being with us. Thank you for your compassion. The photographer who took that picture was Go Nakamura of Getty Images, we should say. You were the doctor. Tell us what's going on there.
Yeah, what's going on is, as you know, I have been very transparent with the media. So I usually have media in our unit so people can see what's going on. So I have the photographer following me. And as I'm going inside my COVID unit, I see that this elderly patient is out of his bed and trying to get out of the room, and he's crying. So I get close to him and I tell him, "Why are you crying?" And the man says, "I want to be with my wife." So, I just grab him, I hold him. I did not know that I was being photographed at the time. And, he was just crying, and eventually he felt better and he stopped crying.
I want to be with my wife, he said. Of course, can he be with his wife right now? Who can he see?
At the present time, he can't. We need to complete his treatment. He needs to be negative on his swabs so that we can then send him out of the hospital. But it's very difficult. You can imagine you are inside a room where people come in spacesuits and you have no communication with anybody else other by phone if you're lucky. I mean, it's very difficult. And when you are an elderly individual, it's even more difficult because you feel that you are alone. You feel isolated.
You just mentioned spacesuit. I mean, that is what is so notable in that photograph. He's the patient, obviously, and you were dressed in all this protective gear. So what was going through your head during this hug?
I was feeling very, very sorry for him. I mean, I was feeling sad just like him. And I was just recollecting all the patients that I've had to do similar things with. I will go into the rooms, I will sit in their bed and chat with them because they truly need somebody to give them a hand. And my staff is very good at doing this. But we have so many patients that sometimes we cannot, hold every patient or grab the hand of a patient, or at least try to be a little more human.
What can you tell us about how that patient is doing this morning?
He's actually doing great. He's doing much better. We are hoping that before the end of the week, he'll be able to get out of the hospital.
Well, that's wonderful news. How often does this happen?
Oh, very often. I mean, people are just, the patients get so sad. Some of them cry. Some of them try to escape. We actually had somebody that tried to escape through a window the other day. They are so isolated. They really want out. It is very sad.
How complicated is it going to be to get the millions of healthcare workers and support staff vaccinated, and how long do you anticipate for that to take?
I mean, we are, I will say that everybody's been working really hard to kind of queue up the distribution chain to get it to healthcare workers. It's a complicated thing. There's no way around it. I mean, even if you say we're focusing on certain discrete groups, that number will exceed supply in phase 1 of vaccine distribution, and we'll have to make some hard decisions about technically at every site who gets it first. The other thing is we have to work in parallel at increasing vaccine acceptance. We're seeing across the country, and even among healthcare workers, there is some real hesitancy at accepting a vaccine, even if it's right in front of you. So distribution is just half of the puzzle, and then making sure that we're doing a ton of education and public messaging to make sure that it is received once it gets to where it needs to go.
Yeah, to that point, you were saying, even when a vaccine becomes available, polls are showing that large portions of the American public say, look, I'm not going to get the vaccine. An Axios Ipsos poll this week showed that just 51% of Americans were willing to get immunized when the vaccine first becomes available, and a full 48% said they won't get vaccinated. There is, though, a lot of safety data out there. How would you comfort the skeptics, Dr. Chu? And I mean, how much of the population would actually need to get vaccinated for it to work?
We really need to understand what the concerns are. I can guess. I mean, we've called the vaccine effort Operation Warp Speed. We've been using terms like emergency use authorization. Those terms really convey haste over safety. And I think what we really need to do is share a lot about what we know about this process, which, as far as we can tell, has been done with great rigor by people who know what they're doing. The safety data, even in groups of elderly people and those with comorbidities, has been extremely reassuring. And so I think part of it is a communication piece. But I think also we need to do a lot of work in communities to hear more from people about why they're so hesitant and what would change things for them. So I think, again, this work is so important and needs to occur in parallel with the distribution effort. Yeah.
I want to talk to you with somebody who did it the right way, okay? Now, the event was huge. The 99th birthday last month for his father, okay? I mean, how many of us are blessed with having one of those in our family, let alone one of our parents? I want to bring in Larry Goldsticker of Plano, Texas, joining me now. Congratulations to your father. Thank you for joining me. Now,
Thanks for having me.
Larry, I want to back into this situation. Now, when you say we tried to do it the right way, what did you do, just so people can understand what boxes you checked?
So his birthday is in October. We started talking this summer and even had the conversation, do we go or not? And we decided we were going to go. Everybody quarantined for 2 weeks beforehand. My brother, who's in San Francisco, and his wife actually got tested beforehand. I drove instead of flying, 10-hour drive instead of flying to be safe. Everybody wore masks. And we did everything we thought we were supposed to do until we got there. And then once we got there, we stayed together, the 12 of us, either in my dad's house or my brother's house. Did not wear masks when we were together. The only time we went out Saturday night for his birthday dinner, 12 of us in a private room, just us, waiters coming in and out. And at the end of the weekend on Monday, pretty much everybody started showing symptoms of COVID.
How many of you got sick?
12 out of 12 that were there, plus I infected my wife, who was not able to join us when I got back here, so 13.
You did everything that you could think of other than canceling the party, and literally all of you got sick. Now, most importantly, Dad, 99, he got it. Is he okay?
He is doing okay. He lost some weight. All of his strength is not back, but I'd say he's probably at 90%.